No one really prepares you for what happens after giving birth. In this video, I'll share 5 things you should expect postpartum, the physical changes, emotional shifts, and practical tips to help you cope. Whether you're a new mom or supporting one, this video will help you feel prepared and less overwhelmed. First, let's understand what postpartum period really means. The postpartum period begins immediately after childbirth, once the baby, the placenta, and the membranes have been delivered. This period usually lasts 6 to 8 weeks or even longer for some women. During this time, your body is gradually adjusting and returning to its pre-pregnancy state. Physical changes may take about 8 weeks to fully settle, but emotional changes can last up to 6 months or more. So what should you expect after having your baby during this delicate period of time? Number 1, postpartum bleeding. The first thing to expect after childbirth is postpartum bleeding, also known as loci. This simply refers to vaginal loss that begins immediately after the birth of your baby, placenta, and membrane. This discharge is mostly made up of blood and tissues as your uterus or womb contracts and slowly returns to its pre-pregnancy size. The color and volume of this vaginal loss will vary from woman to woman, but it's normal to experience heavier bleeding in the first few days. Over time, it should gradually decrease and become lighter. So here are some remedies and care tips. Number 1. Use postpartum pads. These are specifically designed to absorb postpartum bleeding. Number 2, change your pads frequently to keep the area clean and prevent infections. 3, take your prescribed postpartum medications, especially those that are given to prevent infections. And 4, watch for warning signs. If you notice the bleeding is getting heavier instead of lighter, or if you pass out large clots, contact your doctor immediately. Remember, postpartum bleeding is completely normal, but paying attention to the changes in your body will help you stay safe and recover smoothly. Physical pain and discomfort. Whether you have a vaginal birth or a cesarean section, some level of pain and discomfort is completely normal. For vaginal birth, the pain is usually felt around the vaginal area, especially if you experience tears or stitches. For a cesarean section, the discomfort will be around the surgical incision site. The duration and intensity of this pain will vary from woman to woman, but in general, it improves as your body heals. Apart from pain in the birth area, there's also a generalized body pain and soreness. Remember, your body has gone through 9 months of carrying a baby, plus the effort of labor and delivery. It's completely natural to feel tired and achy during this time. Another common experience is breast engorgement. This happens when your breast produces more milk than your baby is able to drink in the first few days. Your breast may feel swollen, hard, and tender, but don't worry, this is completely normal and will improve with time and proper care. Remedies and care tips during this time. Number 1, warm bath. Taking a warm bath can help to relax your muscles, ease tension, and provide soothing relief for body aches. 2, supportive bras. Wearing supportive bras that are not too tight or not too loose is important. They should give your breast firm support while still feeling comfortable. This can help reduce pain and swelling. 3, gentle warm cloth massage. Gently massage your breast and other sore areas using a clean warm cloth. This helps improve blood circulation and relieve discomfort. If you're unable to do this yourself, ask a trusted person, maybe your spouse or a caregiver, to assist you. Number 4, Steeze bath. A Steeze bath is especially helpful if you had a vaginal birth. It helps relieve pain, reduce swelling, and speed up healing in the vaginal area. Here's how to do it. Fill a shallow basin or a bathtub with warm water, just enough to sit in comfortably. Add small amount of salt or soothing herbal tea to the water. Sit in the water for about 10 to 15 minutes, making sure the warm water covers your lower body. When you are done, Gently pat the area dry with a clean, soft towel. This process can bring a lot of relief and promote healing. 4. Pain relief medications. Do not hesitate to take prescribed pain relief medications such as paracetamol or ibuprofen. These help reduce discomfort and make you recover easier. However, only take medications recommended by your doctor or healthcare provider. Remember that pain after childbirth is normal, but it shouldn't be unbearable or worsening over time. If you notice severe or increased pain, always consult your doctor. Emotional changes. The postpartum period is not only about physical recovery, it is also a time of emotional adjustment. During this stage, a woman is readjusting psychologically, socially, and physically to her new role as a mother. While every woman's experience is unique, emotional changes are very common and completely normal. Some of the normal emotional changes you may experience include 1. Feeling more vulnerable or indecisive than usual. 2. Exhaustion and increased emotional sensitivity, like crying easily or feeling overwhelmed. 3. Fear of the unknown, especially if this is your first child. 4. A mixed realization or a sudden realization of the huge responsibility that comes with caring for a newborn. And 5. Mixed feelings, moments of joy, love, and closeness to your baby, alongside feelings of helplessness, frustration, or even disappointment. These feelings happen because childbirth is an intense experience, both physically and emotionally. Your body has gone through major hormonal changes, you are adjusting to new routines, and you may not be getting enough rest. All these factors can affect your mood and emotions. Sometimes, these mood changes can become more serious and move in a negative direction. The 3 most common negative emotional changes are postpartum blues, also called baby blues. This is very common within the first 2 weeks after delivery. You may feel weepy, anxious, or unusually emotional, but these feelings usually improve on their own with adequate rest and support. 2. Postpartum depression. This is more serious and lasts longer than baby blues. Signs include deep sadness, hopelessness, or feeling disconnected from your baby. If you notice these signs, please reach out to your doctor immediately. 3. Postpartum psychosis. This is a rare but very serious condition. It may include hallucinations, confusions, or extreme mood swings. This is a medical emergency and requires immediate attention. To care for your emotional well-being during this period, surround yourself with people who genuinely care about you. Accept help when it is offered and don't be afraid to ask for support. Get as much rest as you can, even if it's just short naps, and avoid unnecessary steps. Finally, be gentle with yourself. Adjusting to motherhood takes time, and there is no perfect way to do it. If you ever feel overwhelmed, reach out to a healthcare professional or a trusted person who can guide and support you. Remember, seeking help is a sign of strength, not weakness. Healing, both physical and emotional, is a journey, and with time, patience, and support, it will get better. Finally, we have sleep deprivation and fatigue. It is very common to be deprived of good quality sleep during postpartum period and even beyond. This happens because babies have no fixed sleep schedule and are no respecter of persons. When the baby is awake, everyone in the house is awake, especially the mother. As a result, most mothers will often find themselves sleeping in short bursts and may feel exhausted and drained most of the time. Fatigue becomes a daily challenge, and while this is completely common, it's important to find ways to cope with it. One way to manage this is by setting up a routine that your newborn can easily adapt to. When babies get used to a pattern, it makes it easier for everyone in the home to rest. It also helps to breastfeed right before you want to sleep, so the baby is calm and ready to rest when you are. Another important factor is keeping your baby comfortable and clean. Ensure that the baby is wearing a fresh, dry diaper before bedtime. A wet or a soiled diaper can cause discomfort and wake the baby up sooner than expected. A clean diaper can go a long way in helping your baby sleep better, which means you get more rest too. The environment also plays a big role. Keep the room calm and quiet, dim the lights, and minimize distractions when trying to get your baby to sleep. This creates a soothing atmosphere that encourages rest for both you and your baby. Do not hesitate to ask for support. You can take turns with your spouse or a trusted family member to watch over the baby or rock the baby to sleep while you get some rest. Even short naps can make a big difference. Adequate rest is very important because a mother who is constantly sleep deprived and fatigued will not be able to function well physically or emotionally. Lastly, remember to take care of yourself by eating balanced meals and staying hydrated. Your body needs proper nourishment to recover and to give you the energy you need to care for your baby. Sleep deprivation is a challenge, but with patience, planning, and support, it can be managed so that both you and your baby can thrive. So to recap, the postpartum period can bring several challenges and changes, from vaginal bleeding to physical pain and discomfort, emotional shifts, and of course sleep deprivation and fatigue. These are all normal parts of recovery and adjusting to life with your newborn. Remember, you are not alone. Every new mother goes through this in one way or another, and with time, patience, and the right support, you will adjust and thrive in your new role. If you found this video helpful, please like, share, and subscribe for more tips on postpartum care and motherhood. And don't forget to leave a comment below. I'd love to hear your experience and how you are coping.